Today we are here with Christy Marcella, who is a healthcare professional at a doctor's office for women's health. Christy, tell us a little bit about your educational background, your credentials, and then what you do here at the office.
Okay, I am a women's health nurse practitioner. I have a 4-year degree in nursing, and then I specialized and got my nurse practitioner license in a women's health, so I'm now a nurse practitioner. With being a nurse practitioner, I can see and treat my own patients. Here at the office, we focus on women's health. We see a variety of different types of problems, concerns, and some just wellness checks with women, ranging in age from, I've seen maybe the youngest age 12, up to I have some patients in their 80s. So depending on what their needs are, we educate, we prevent, and we treat.
Okay. As far as prevention, what kind of screenings or tests do you do to maintain somebody's health?
So with somebody who's younger, maybe 12 up to 18 or so until become adulthood, I do talk to them about just getting comfortable with their body. It is changing, and if they have any questions or concerns, so please call the health care provider, not necessarily go online to look for the answers, because it's not always factual. Also, we all develop at a different rate, so maybe the way I look is not necessarily the way your friends look, and that is okay. For testing, necessary, not anything at that particular age, unless you're having painful periods, periods that are coming more frequently than once a month. You need to talk to your healthcare provider about that. Some of the over the age of 18 up through menopause, we do breast exams. We feel for any abnormal masses, and I do educate my younger ones. Also, if they feel anything abnormal, they need to call their healthcare provider. We do listen to heart and lungs, and then we also do a GYN exam. We do a pap smear, possibly an ultrasound, to look at their ovaries and their uterus.
Okay. Can you tell us a little bit more about a mammogram first?
Yes. So a mammogram, right now it's indicated that you get that starting at age 40. I have done mammograms on younger girls age 35. It's real important that you talk to your healthcare provider about their family history. A lot of things are guided with what your family history indicates. Also, I have my girls do yearly breast exams. With that, you're feeling the breast tissue. You're feeling for anything that feels abnormal. I always say, if it wasn't there before and it's different, you need to call your provider. At that time, we will do a mammogram. It's an easy test to do. It's done at another facility, and they're looking for abnormal tissue.
And of course, the abnormal tissue, you're trying to rule out breast cancer at that point.
Yes, absolutely.
Okay.
If there is abnormal tissue identified, it does not mean you necessarily have breast cancer, but it's something too that will then allow the provider to further investigate.
Is there any way you can kind of show us a little demonstration of what you would do for a breast exam if a patient came in for that routine screening?
Yes. So when you come in as a patient, I do breast exams on any patient over the age of 18, and I recommend that you do get comfortable with the way your breast tissue feels, because we do have normal lumps and bumps in our breast. But as you can see here, as a provider, we'll have you sitting on the end of the table, put your hands on your hips, and we look for any skin changes in the breast and looking for any visual discoloration also in the breast. The provider then will have you lay back, put your arms up over your head. We do have breast tissue all the way up into the armpit or the axillary area. And what I do, I use a pie shape. Can do circular. I start at the nipple and go out in a pie shape, and you're pressing lightly and a little bit deeper on the breast, and you're feeling for anything that has an edge to it. It may feel like a marble or a pea, or any thickness, anything that feels different. You need to let your provider know. I recommend that patients do this the week after their period, for your breast tissue is not as tender and or thick. Great place to do this would be in the shower. You're doing washing yourself anyways, and I always tell patients you're typically always doing this, but I would be more conscious on if you're feeling something that would be a difference. So the main thing is if you feel a difference in your breast, it's never too young to get comfortable with what your normal breast tissue feels like.
Okay. And then show us some of the things in this exam room that might be involved with doing the vaginal exam and then a pap smear.
So in our office, we use gowns that are cloth. I know some facilities use paper gowns. You would typically, before you come into the exam room, we get a blood pressure weight and a weight on you. If you're having any urinary tract symptoms or burning with urination, we would probably have you get a urine specimen. And then we bring you into the exam. We have you get completely undressed while the provider's not in the room or any of the staff members. And then we have patients put on a gown. And like I said, some gowns are going to be paper. We use a cloth, and then I have the patients tie it in the front, some tie it in the back, and there's really truly no wrong way to do it. So don't let that worry you with you getting your exam.
But they'll tell you when you arrive when they give you instructions for
Yes.
undressing whether it should open in the front or back. Okay.
And then we have them remove their clothes, their bra, and their underwear. And then you put the gown on, and then we also provide a drape for the patient that when they're sitting up here on the top, then I go ahead and I have this over their exam or over their lap just so they're a little bit more comfortable.
Gotcha. Okay.
And then when you're done with your exam, you can go ahead and get dressed and just, so you don't know where to put your things, just put everything on the table and the healthcare provider and or the staff will clean the room up for you.
Okay. So when you would first arrive, the patient would be sitting on the edge of this table, and then you would give them instructions for the next steps. And what would those be?
So what I will do with my patients is I go through their family history. I ask them a series of questions, indicate why they're here to see me today. It's a very casual, open conversation. You need to make sure that you tell your provider any concerns you have, because if you don't tell us, then we don't know how to help you. And no question is embarrassing. We have been asked everything and anything, so never hesitate to ask us any question. If they're getting a pap smear or a vaginal exam at the end of the table, I ask them to lie back, and then you're going to put your heels here in the stirrups. Your body's going to come to the end of the table, and your bottom's going to be right here at the end of the table. My main suggestion or encouragement or words of wisdom is just try to be really relaxed as possible. I know it's uncomfortable and embarrassing to be here at the office with your provider, but this is what we do for a living, and you just need to be at ease and trust that we're not here to hurt you.
Yeah. Now, if it was a minor, would their parent be in here, or is that an option?
Yeah, so if they're a minor, we're going to ask the parents be in here, but I really recommend anybody be in here with a patient as long as the patient is okay with that.
Okay.
I've had spouses be in here. Some don't want anybody in here, and that's okay too. There is patient confidentiality. I always tell patients, if you are a minor, there are things that I do keep confident to the family members unless you were at harm or were indicating that you were going to harm yourself. I need to reach out to the family.
Gotcha. Okay.
If we were to do a pap smear on you, those typically guidelines are always changing. If something's been a patient's been sexually active, I do recommend that you get a GYN full exam with a pap smear.
Okay.
Our drawers are warmed. So this is a real nice warm drawer. This is what a speculum looks like. Some are metal, we use plastic. And we also have a light that is inserted at the end of the speculum. And this allows the provider to look vaginally. This is placed inside the vagina, and then it's slowly opened. This is how I show my girls. This is your vagina. It's and placed inside, slowly opened. What you feel at this moment is pressure. Nothing should be painful, and if it is, you need to let your provider know. And what we're looking for is the cervix, which is the opening to the uterus, and that's where the pap smear is taken.
Okay. And the pap smear involves...
So pap smear, we use a brush. Cervix looks like the end of a hot dog.
Okay.
Yeah. Put the brush in and just twirl it around a couple times. This is a real soft brush. It does not hurt. And then we also use something called a spatula over the cervix, and we brush that.
Okay. And that gets you some cells that you can then send off to study.
Yeah, this goes, cells goes in pathology. What we're looking for there right now is the HPV virus, which is very common, which can cause abnormal cell growth with left undiagnosed and or treated could lead to cervical cancer. Pap smears also pick up yeast infections, bacterial infections. I've had a pap smear come back with a positive herpes on it, so your provider may be calling you for other things that were picked up on the pap smear.
Okay.
After the speculum exam, the provider will, they have gloves on, but they do put a little KY jelly in the end of their finger, 1 or 2 fingers. It is inserted gently in the vaginal area. We press on the top of your stomach. We are feeling the size of your uterus. We're also feeling the size of your ovaries and indicating if you have any pain, pressure, and or cyst on your ovaries.
Okay. Okay. And this is recommended starting at what age or with?
So right now they recommend, I would say around age 21.
Okay.
Yeah, that you get routine pap smear exams. I do recommend if you've been sexually contact that you do talk to your provider about possible screening
Okay.
sooner.
Okay. Any other screenings at this point that we want to talk
So
about?
we do, every provider is different. Family practice, a lot of times we'll screen for yearly cholesterols, blood sugars, and thyroids, but we also do that here. So if that hasn't been done within a year, I start that at age 18, and I would do that routinely for cholesterol, fasting blood sugar, thyroid. I look at vitamin D levels. If someone has heavy bleeding, I may do a CBC on it and make sure they're not anemic.
And CBC is testing for?
A complete blood count.
Okay.
So you're looking at your white blood cells, your red blood cells, your platelets, and your hemoglobin.
Okay. Any last words about screening?
Nope. The only thing I would recommend that you get comfortable with your provider. You be open with your provider and know that your provider is not there to force anything upon you. If you're not comfortable with an exam at that moment, talk to your provider about that. We need to know that, and maybe it's a process that we bring you back in a couple appointments and eventually do a pap smear exam. So they are necessary, but know that your provider is here to help you and not hurt you.
Very good. Thank you so much.